I am Dr. Ala Gopalakrishna Gokhale, cardiothoracic transplant and minimal access surgeon. We all know that heart is one of the most important organs in the body to keep us healthy. It pumps blood so that it supplies oxygen to all the tissues in the body. If the heart is not working well, none of the organs in the body can work. It has been working continuously from the time we start our life in mother's womb till we die. Now such heart can get affected by various disorders. In that situation, heart may not be able to pump blood to the body. The other organs in the body may get damaged. Similarly, people may get chest pain, heart attacks, like that. There are many conditions that can affect the heart. For example, one of the most important things is blocks in the blood vessels that supply blood to the heart. See, the heart, when it supplies blood to the body, it also requires blood supply. There is one blood vessel on the front that supplies blood supply. There is one on the right side, one on the left side. These three blood vessels supply blood needs of the heart. Sometimes these blood vessels can get blocked because of deposits of cholesterol or fat inside that, and they can produce heart attacks. Similarly, heart has got some valves inside the heart. There are 4 chambers in the heart. On the right side, 2 chambers. On the left side, 2 chambers. Impure blood comes here. From here, it goes to the pumping chamber. When it pumps, it goes into the lungs, both sides, where it gets purified, then comes to the left side. From there, from the upper chamber, comes to the lower chamber. This pump blood throughout the body through this valve here. So to make sure that the blood is going rightly in the heart, to keep the efficiency to the maximum, there are 4 valves inside that. There is one here, there is one here, and then one here. These valves make sure that the blood is going in the right direction. Sometimes these valves can get affected. They can cause a leakage. Instead of going forward, some of it may leak back. Sometimes there may be narrowing of the valves. And there are many more conditions that can affect the heart. The other one is, like, for example, viral infections that can affect the muscle pump. The muscle of the heart may get damaged. Sometimes in alcoholic people, it can get damaged. Like, there are many conditions that can produce problems to the heart. When people come with some of these problems to us, either because of chest pain or breathing difficulty or palpitation, we try to manage them with medicines after the investigations. Sometimes disease may be very advanced. We all keep hearing about heart surgeries these days. The moment we tell a patient that he requires a heart surgery, it may be bypass surgery or valve operation, sometimes to close the holes which have been there from the time of birth, people get scared naturally. Normally what we do is, when we are doing a heart surgery, we give an incision of about 15 to 20 centimeters on the front of the chest, cut this breastbone, go inside, and then we stop the heart most of the time to change the valves or repair the valves or do bypass surgery. Sometimes these days we are able to do what is called beating heart surgery without stopping the heart. However, the moment we say that you require a surgery by through an incision on the front of the chest, many people say, "Doctor, can we avoid surgery? Is there any less invasive than this? Maybe I would like to go to angioplasty." Some of our patients, even though we tell them that surgery is life-saving to them, they get worried and they say, no, we don't want to have such a big cut on the front. We don't want to face infections. We don't want to rest 2 to 3 months. So please give us some other option, like angioplasty. It may not be as good as surgery. They often choose for the second best option. For patients who are requiring surgery for valve problems or for birth defects, we make a small incision of about 6 to 7 centimeters on the right side of the chest, below the breast, and through that we go towards the heart and do those surgeries and come back. For those who are requiring bypass operations, we do it from the left side by a small incision, 6 to 7 centimeters. You see, normally the incision is about 15 to 20 centimeters, whereas in this minimal access surgery, the incision is only 6 to 7 centimeters. And again here, the scar sometimes become very huge, called keloid, very difficult to control it. Some of the young girls often refuse to get this surgery done, whereas here the scar is very small and cosmetically very nice. And when we do this minimal access surgery, the other advantages are blood transfusions are less, infection complications are very less, and the recovery is very fast. When we do the surgery on the front, when we cut the breastbone and we stitch it back, it takes almost 2 to 3 months for people to recover. Whereas through the minimal access surgery, they recover in about 3 to 4 weeks' time. After that, they can get back to the work, do driving, go for the job. However, there are a few things we need to know about minimal access surgery. It requires more expertise. Not everyone cannot do this operation. Only people who have got exposure, experience in this can offer this surgery. Again, all patients cannot be operated through this means, even if you want it. Most of the value patients and those who have birth defects, they can be operated through minimal access, almost 80 to 90% of the people. Whereas for bypass surgery, only about 15 to 20% of the people at this stage are suitable for it. We can do not only one graft, we can put 2 grafts, 3 grafts, or 4 grafts, whatever are necessary for the patient. But we choose those people who will tolerate this procedure very well. Only those people we offer this minimal access surgery. I'm sure in the next few years to come, better equipment will come. More and more patients will be operated through minimal access surgery so that they can recover fast, they recover with a smile, with less pain, less complications, and get back to normal life very fast. Our team has one of the largest experiences in minimal access surgery in our country. We have been conducting workshops regularly for the last 3 years to train hundreds of heart surgeons throughout the country and abroad so that they can learn these techniques and help their patients recover faster.